It really is. And, if you're someone who happens to carry medication with you in your purse or in your car, you might want to think twice about that. Dr. Sarah Westberg joins us now to explain why. And Sarah, first off, good morning to you.
Good morning. Thanks for having me this morning.
You bet. What exactly happens when you have medicine exposed to the heat for a prolonged period?
Well, medications are studied generally for most medications at room temperature, which is generally defined tightly between 68 and 77 degrees Fahrenheit, although some windows have it at 59 to 86 degrees Fahrenheit. When medicines are outside that temperature, especially for prolonged periods of time, they might lose a little bit of their efficacy and not work as well.
Okay, can the medication, so it might not work as well as it was intended to, right? Can it also kind of affect like the textures and things? Like, can your medicine melt or anything like that?
Some medicines are sensitive to that. Medications like nitroglycerin are very sensitive to that. When exposed to high heat for a prolonged period of time, people will notice that it becomes powdery and will definitely lose some efficacy. Gelatin capsules might get kind of melty and sticky in really hot temperatures. So it is something to be careful with.
So I'm sure a lot of it's common sense. I mean, if you look at your medication and you just see that it seems to be in the shape and melted, obviously you don't use it. But are there's some types of medication that tend to be a bit more sensitive to heat than others?
Well, I mentioned nitroglycerin is a common tablet form that's sensitive, but there are many injectable medications, and there's many medications on the market now where patients are self-injecting medications. Insulin's a really common example where we generally keep it refrigerated, but once it's open, it's good at room temperature for 28 days. So if you're traveling in high heat with an injectable medication that has that sensitivity, it's probably best to keep it in a cooler so it stays closer to at least room temperature, not refrigeration temperature.
All right, we have less than 30 seconds left. I just wanted to ask you, so sometimes it takes a few days to get your medicine refilled. So if you know yours is bad or has been affected by heat, like what should you do? Can you still use it anyway or not?
Most likely you can. And the best thing to do is to ask your pharmacist. They have expertise in this area and they can help you decide what's best based on the specific medication you're taking.
Oh, Jackie, that was a great question. And Dr. Sarah Westberg, that was a great answer. Yeah, from the University of Minnesota College of Pharmacy. Thanks so much for joining us. Yeah,
absolutely.
Goodness. All right, you know what's coming up on